is a common, highly contagious bacterial infection on the surface of the skin that is prevalent in children. It's also called school sores. It's characterized by red, pus-filled blisters, often on the hands, the feet, the face, nose, the mouth, which later turn into yellowish or brownish crust. So it usually starts dito sa may area ng face, dito sa may nose, dyan parang nagsusugat, tapos may mga paltos. So there's blisters and then it becomes crusts. Medyo yellowish yung coloring, brown to yellowish. And then, is impetigo contagious? Yes. So nakakahawa siya. Impetigo is a highly contagious condition and can be passed on through skin-to-skin contact with an infected person or by using personal items infected with impetigo-causing bacteria such as the bedding, the clothes, or towels. So usually I see this in small kids, and then nahawa sila sa other mga kasama nila sa bahay or mga iba pang mga bata. So nakakahawa talaga siya because it's a bacterial infection. So who is at risk for impetigo? Although impetigo is common in children aged 2 to 5 years old, older children and adults may contract it from an infected individual. Athletes are also deemed to be at a higher risk for impetigo due to skin-to-skin contact or sharing of personal belongings such as towels. In addition, people who live in warm, humid places, so tayo yun, are likewise at an increased risk. So, usually yung mga bata nagkakaroon ng ganitong condition, hindi naghawa-hawa talaga sila. So, it's common in this age group, mga 2 to 5 years old, because they like to play, they like to, like hold each other, play with each other, hug, so yun, kiss. So, that's when they spread the infection. So, what causes impetigo? So, impetigo is frequently caused by a bacteria. It's called Staphylococcus aureus, and at times by Streptococcus. So, such bacteria usually enter the body through a cut, a scratch, an insect bite, or any break on the skin. Sometimes it can penetrate normal or unbroken skin. So, usually, nakuha siya when the child scratches it. So, dahil meron ng exposed skin, that's when more bacteria will come in and then it will spread to other parts of the body. So what are the signs and symptoms of impetigo? Impetigo causes the skin to become red, sore, and itchy. Glands may swell, but it's not common to have a fever along with it. So sometimes kapag mas marami na talaga, it causes fever. There are two types of impetigo, the non-bullous impetigo and the bullous impetigo. The non-bullous is the most common type of impetigo. It begins with one or more sores. It's usually itchy. The sores burst right away, leaving the skin with a red or raw affected area. Crusts eventually form, mostly honey colored. So medyo brownish talaga siya to yellowish. Glands near the sores may feel swollen. No scarring develops during healing unless scratching has cut deep into the skin. So that's a more common, the non-bullous one. The bullous one naman causes fluid-filled blisters. So yun, may mga paltos talaga siya, but is not accompanied by redness on the surrounding skin. Blisters contain a cloudy or yellowish fluid. These blisters become limp and transparent before breaking open. Crusty sores develop where the blisters have broken. The skin usually heals without scarring. So the first one, siya, parang siyang mga crust na agad. So meron siyang maliit na sore and then it will become a crust. That's the non-bullous type. The bullous one naman, meron muna siya mga paltos or mga vesicles and blisters. Saka siya magkakaroon ng mga crusts. Yes. And then, how is impetigo diagnosed? A dermatologist is trained to diagnose impetigo, sometimes by just looking at the skin. However, it is possible that the doctor will take a sample of the infected skin and conduct laboratory tests to extract some information that can help determine the best treatment. So, clinically, this is diagnosed now already. So that means now when you have a consultation with a board-certified dermatologist, ideally they would be able to just diagnose it just by looking at the skin of your child. Okay, so however, it's more extensive, or sometimes may ibang pang naisip na differential ng doctor. That's when we have some tests to confirm the diagnosis. So what is the treatment of impetigo? Dermatologists often prescribe an antibiotic, cream, or ointment that can be applied to the skin, such as mupirocin, fusidic acids, really depends which one they prefer for you. For recurrent outbreaks, the doctor may decide to apply a medicine inside the nostrils or give an oral or injectable antibiotic. So this one kasi, it's spread first sa nose. That's why mapapansin sa patient, it starts here first and then it spreads sa ibang parts ng body. That's why we recommend na mag-apply ng antibiotic dun sa nostrils. Not only dun sa affected person, but even dun sa mga kasama nila sa bahay kasi baka maghawa-hawa sila. That's why we recommend that one. When topical corticosteroids are used on impetigo and other skin infections, these must be combined with an appropriate anti-infective agent. So sometimes we recommend a steroid for the redness, for the inflammation. Of course, like I said, you have to consult a board-certified dermatologist first before applying anything on your skin or taking anything, because we can tailor the medication that we recommend to you depending on what the condition is at the time that we see you. How can the recurrence of impetigo be prevented? Okay, because impetigo is highly contagious, it is important to take precautions to reduce the risk of recurrence. Here are some useful tips. Okay, so number 1, whenever there is a cut, a scrape, an insect bite, or any kind of wound, immediately wash it with soap and water, apply an antibiotic ointment over it, and then a bandage. So the purpose of this is to decrease the chance of spread, because of course, like I said, impetigo, it's spread through the cut. So if it's exposed, mas dadami pa or kakalat yung infection. Number 2, bathe after sports activities and make sure to use a clean towel to dry the body. So right after, if your child likes to go to sports, nagpo-football, uso yun ngayon, then you have to have them wash their skin so that the bacteria malinisan, and then to make sure that they use a clean towel, of course, because if you keep reusing your towel, if it's already infected, of course, it's like reinfecting your skin again. Next is always wash your hands thoroughly after using the toilet and when they get dirty, because more often than not, it's spread through the nails. So if you wash your hands, you will decrease the bacteria in your hands, and the chance of infecting other parts of the body is, of course, decreased then. Do not share personal belongings such as sports equipment, towels, and clothes, because this is contagious. Huwag mag-share. Pwedeng ibukod na if you have one child, you have like several kids having an infection. If isa pa lang ang merong ganitong sakit na impetigo, you just set aside their clothes para yung ibang mga bata hindi mahawa. So this is my video because I do like sharing skin conditions that are not just like, for example, pampaganda or just cosmetic. I think dermatology is a specialization with so many other skin conditions. Hindi lang acne, hindi lang anti-aging ang ginagamot ng dermatologist. Even the pathologic conditions like impetigo and others should be addressed as well. And I hope this video has been informative. Don't forget to seek a consultation with a board-certified dermatologist within your area. We have been trained and will be able to help you with whatever skin, hair, and nail problems that you have. Thank you for watching my video again. It's been a while since I last posted a video, and I do appreciate all the the comments. I answer your comments and questions personally, so if you would like to comment below, feel free to do so. And thank you for subscribing to my channel. Please, if you haven't subscribed, please subscribe to my channel. If you're within La Union, please come visit me. I'll be here. I'm here in the clinic Monday to Saturday from 9 a.m. to 5 p.m. And I will post the number below. And I'll see you in my next video. Bye!